Welcome back everyone. So as promised, here is the follow-up video to our last video where we discuss the fact that the Inflation Reduction Act has many provisions in it that are kicking in this year that only will benefit seniors and the elderly. So here is more great news for you folks. We have a lot to talk about in today's video. If you are excited to hear about these benefits, definitely give this video a tremendous thumbs up, smash the like button. I would appreciate that. If you haven't already, of course, make sure that you are subscribed and have notifications turned on. That will notify you every time we do post a brand new video or go live on this channel. And the next cash giveaway will be at 30,000 subscribers. So that is also something to look forward to and consider. And if you didn't get a chance to catch that initial video where we talk about the $35 monthly cap on insulin and other good news for seniors, definitely check out that video. The link is down below in the description. You can watch that one after watching this video. So this week, the Biden administration unveiled a plan for Medicare drug price negotiations with pharmaceutical manufacturers. If you recall, the Inflation Reduction Act, which was passed by Congress last year, effectively grants the federal health program that serves older adults and disabled people the authority to negotiate drug prices. Now, the agency will select the first 10 drugs to negotiate this year, but the price changes won't take effect until the year of 2026. So with this particular provision, you will have to wait. Now, according to the administrator for the Centers for Medicare and Medicaid Services, ultimately Medicare will solicit feedback from the public, consumer advocates, drug manufacturers, and others on its blueprint that aims to, quote, ensure that people with Medicare pay fair prices for some of the costliest medications. So you won't see these changes happen overnight, but these prices will start to come down and this will lead to more savings in your pocket. So when can we expect these drug discounts to begin? Let's take a look at this timeline that will tell us a little bit more and clarify the sequence of events that we can expect. So on September 1st, or at least by that date, Medicare will announce 10 retail drugs to negotiate maximum prices. In 2024, the agency will bargain with drug manufacturers and publish prices by September for prices that will take effect January 1st, 2026. Now, over the following 2 years, the federal health program will target another 30 retail and physician-administered drugs. Beginning in the year of 2029, Medicare will negotiate prices on up to 20 drugs each year, and that is when we could start to see some real exponential change. Now, it's important to note that retail drugs are only eligible after they've been on the market for at least 9 years, and they also can't have a competing generic version. Physician-administered drugs will have 13 years before being subject to negotiation. You have to understand that the Inflation Reduction Act is one of the most consequential healthcare laws that was passed since the Affordable Care Act. Now, a question on people's minds is, could we start to notice these price changes sooner? The good news is that pharma companies that raise drug prices higher than inflation must pay rebates to Medicare. That law applies this year on retail and physician-administered drugs. So if you start to see these pharma companies get a little bit greedy, you're going to see this money come back to you. And in Biden's defense, administration officials have said that U.S. drug prescriptions are more than double the price in other high-income countries. For example, from July 2021 to July 2022, pharma companies hiked prices an average of 31.6% on more than 1,200 prescription drugs, according to a U.S. Department of Health and Human Services report. And a Kaiser Family Foundation analysis found half of all drugs covered by the federal health program for older adults and disabled residents had price increases above the rate of inflation in 2020. Now, certainly this will be beneficial to senior citizens, but how do these Medicare changes ultimately affect younger adults who also need these drugs as well? Unfortunately, experts say that the Medicare price negotiations will do very little to help the majority of America. This is especially true for those that get coverage through their employer or purchase plans on their own, or of course are uninsured. According to experts, major drug companies likely seek to maintain high list prices as they contend with inflation and rising materials and supply chain costs, and the amount a consumer ultimately pays depends on their coverage and a system of complex drug rebates. According to the CEO of DIRX, which is an online pharmacy, he had said, quote, the system is all reliant on reimbursement metrics and rebates, and that's where the problem is. Now, according to the CEO of 46 Brooklyn Research, which is a nonprofit that researches drug prices, he had said, quote, that Medicare's negotiations could affect the prices private employers and working age adults pay for all drugs, and while Medicare and its recipients could benefit from lower priced drugs and monthly caps on insulin costs, drug manufacturers might seek to shift costs to other populations. He went on to say, quote, when somebody gets the best price, everyone else is getting a worse price. Drug pricing is a tale of have and have-nots. When Medicare becomes more of a have, the question is who becomes who of a have-not, and that is unfortunately the case with so many of our systems in the country, not just when it comes to drug prices. And the Inflation Reduction Act will also help the United States of America achieve maximum vaccine access and uptake. One of the many achievements in the IRA, or Inflation Reduction Act, is aligning Medicare's vaccine coverage with that of all private health insurance in the United States. Once implemented, nearly 9 out of 10 Americans will have access to vaccines with no cost sharing, or what's known as first dollar coverage. Copays, deductibles, or coinsurance do not apply for receiving any vaccine recommended by the CDC's Advisory Committee on Immunization Practices. So that's another great development for our seniors. Again, these advancements will not happen overnight. You're not going to see this by tomorrow, but these implementations will absolutely help our elderly, and you will start to see more savings in your pocket along with your Social Security benefits, which hopefully will be above inflation, or at least tied to inflation as well. It's fantastic that we're holding these pharmaceutical companies accountable, and we're trying to keep these costs lower and stop them from making these prices absolutely unaffordable and inaccessible. I'm curious, what are your thoughts on what the Inflation Reduction Act is going to do? Do you think it's doing enough? Do you think it should be doing more? What changes are you looking forward to? Let us know your thoughts down below in the comment section. I am curious to hear. We'll try to keep it PG-13 at worst. Let us know. We will have more updates and developments as these changes do start to get implemented, and there is so much that we have to cover in the coming weeks and months. So make sure you are subscribed and have those notifications turned on. So important, so that way you don't miss a beat. All updates can be found right here on this channel. This is your one-stop shop. And if you haven't already, of course, make sure you give this video a tremendous thumbs up, smash the like button. Make sure you share this video with a friend, with a coworker, someone that you think will get knowledge and value out of this particular information. And if you guys want to get some free stocks, all on me, all free, just for supporting the channel, make sure you go ahead and use the brokerage links down below in the description of this video. Sign up with the brokerage platforms Robinhood and or Webull. You'll get some free stocks, some value up to thousands of dollars in some cases. So let us know what stocks you get. And if you want to connect me on social media, across the board, Instagram, TikTok, Facebook, use the social links down below. I look forward to seeing you guys in the next one. Take care for now.